So guys, this is Dinner with the Doulas. We came on about 2 weeks ago. IG was giving us issues because we were trying to stream to both Instagram and Facebook at the same time, and it was not allowing us to do that. We have now realized that that's a whole technical issue, so we're going to work on that a little bit later. And since it is World Doula Week, we decided to come on and talk about literally why we decided to become a doula. We know it's hard work. We know it's a decision that we make. We know we get into it. But I feel like it's still a decision, and most doulas have some type of pivotal moment in their life where they're like, okay, this is it. I'm going to do it, and this is just today. And so, Miss Jenn, you want to start?
No, not particularly, but let's jump into it. So, I always expect to go last and stuff like that, but why did I become a doula? So I became a doula 6 years ago, and I became a doula after like a brief encounter with a young lady. She came to me and she started talking to me. She's like, oh, I'm about to give birth. She was like 8-9 months pregnant. And she's like, yeah, I really, really want a natural birth. And I was like, oh, okay, what have you done to prepare? And she was like, well, nothing. And I was like, oh, that's scary, because at the time I had already had 2 kids, and I understood like how much preparation I went through to experience the births that I had. And then she starts explaining to me how her doctor told her that she would likely have to get a C-section or be induced because the baby was too big to fit through her pelvis. Now she wasn't particularly big, but neither am I. And so the term that he was referring to was CPD. And most people, most doulas will know like this, the term and stuff like that. It has a long name to it. And if you could correct me on it, I can't say it. Do you know what I'm talking about?
You said she was CBD?
CPD. CPD? Like Charlie Papa Delta? You've never heard of that?
But the main ones I've heard is gestational diabetes, and they talk about how the baby is just going to be so big that mom's not going to be able to get him out.
Yeah, so CPD is like cephalopelvic.
Cephalopelvic disproportion.
Oh yeah. So all right, thank you. So, but this is actually a very uncommon thing. CPD, it refers more to like when women weren't getting the nutrients that they needed, and their bones started to curve and stuff like that. And so I understood that she didn't likely have this. She didn't have gestational diabetes. She didn't have any of the big ticket items, but they were just saying like, oh, your baby is too big. And so, from that point, I was like, hey, look, I wasn't even a doula yet. And I was like, hey, look, just call me. Like, I know I can help you. I can walk you through a natural childbirth. Like, I know I can. And it's, she was like 8-9 months pregnant. She never called me. And I went through this cocoon of the space where my heart was just so open that I needed to do something. And so my husband comes to me one day and he's like, man, you still stressing over this. Why don't you become a midwife? Or why don't you become a doula? And I was like, I know, I'm going to become a doula, and I said it almost like it was my own idea and stuff like that. But it absolutely wasn't my own idea. And so like the very next month I was in doula training, and it was a wrap after that. Like for me, like my position was always like, I will never stand by and watch another woman go through a labor experience that they don't have to go through. You know what I mean? Like if I have information, I'm definitely going to be there to either walk with them as they journey or give it to them so that they could, lay their own path and stuff like that. So that's why I became a doula.
I love the stories. Come on, Nicole.
So my journey was a little different. So I always absolutely loved birth, like all through school. I always, remember that story? What's that, like the real reality TV way back in the day, Birth Story. And then they had like the maternity something ward or whatever. I used to watch like all of that, like absolutely loved it. Knew I was going to be an obstetrician one day. My mom sent me to medical camp and it absolutely went left. They told me I was going to have to work on like cadavers, and I was like, nope, 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 not doing this to bring babies. Like I kept saying, I remember saying like, but I want to bring life into the world. And they were like, yeah, but you got to go through like dealing with the dead bodies first. And I was like, no, that's not going to happen. So completely shelved the idea. Still absolutely was in love with birth. Went to school actually for engineering. And while I was in college, ended up getting pregnant. And my first pregnancy, the pregnancy itself went very well, no problems. I went through like all these natural childbirth classes. I showed up at the hospital with like 10 pillows and rice socks and all these things. Like, I'm going to do this unmedicated. I just knew. And I showed up and everything just sort of like out of nowhere went haywire. And at the time, all I knew was like everything that I had learned about unmedicated birth went out the window. Like now they are putting me on Pitocin. Now I'm like stuck in the bed where everything I learned was like, get up, move around, change positions, all this stuff. So everything, my whole game plan changed. I don't know what to do. I'm in pain. Let me go get an epidural. So I get an epidural. Now, oh, wait. The heart rate is dropping. Oh, there's this problem. It's like all these paramounting issues. And I literally ran to get an emergency C-section. Like, I remember them turning to my mom. My husband had walked out of the room at the time. And they were like, if you can run, you can make it. But that's it. Like, they literally ran me down the hall and got baby out like within a matter of minutes. And so he was fine. I was fine. But it just sort of changed the way that I looked at birth. And then a year later, I had another baby, and I just automatically went for a second C-section because no one ever told me that there's an option to have a vaginal birth after cesarean. Like, that wasn't a thing. I just, oh, okay, I had one. I'm supposed to have a second one. So went and did that a second time. This one was planned, and I ended up with severe postpartum depression for a while. So then that was a whole nother ideal, or I guess, non-ideal situation. And so the whole birth thing just sort of stuck with me, like, and I started helping other people unknowing that there's such thing as a doula at that time in childbirth. So I was supporting other people. The very first person I supported was like my sister. So I was dueling. Her daughter's about to turn 13 now. So it's been about almost 13 years that I was like helping people. And I remember I was driving somewhere and I was like, literally just talking to God, like, what is my passion? Like, I really want to be in birth. How do I make this happen? And do I want to be a midwife? Do I want to be a labor and delivery nurse? All these things, and just round and round. And somewhere in there it popped up like doula. Like, I was just looking through things because I was looking at having another child at the time. But it's like this thing called doula popped up. I'm like, well, what is this? Wait a second. And from there, like Jen explained, like, it's like it just hits you like, wait a second, that's what I want to be. Like, I want to be a doula. And so I just started researching. I reached out to a bunch of doulas in my community, spoke with some of them, reached out to some training organizations, and then ultimately, same thing, trained and got certified. And I guess I haven't looked back since, really, is the best way to put it. But just the same thing, like now looking back, I clearly know, like in my doula role, that all the things that I went through in childbirth, the things that I went through in postpartum, all could have been avoided had I had somebody walking alongside me, giving me different information, and just, educating me on the things that I could have or should have been able to do. So.
Yeah, that's good. That's real good.
That was good. Like, wow, so many women are like, yeah, I didn't know that I can have a vaginal birth. I thought that I was just always told that once you have one cesarean, then you have to have another one. And that's kind of the way birth.
And some doctors are still on that path. Like my doctor's office, when I was talking about having kid number 3, the first thing out of my doctor's mouth was, that means you have to have a 3rd cesarean. And after that, we'll just tie your tubes because we don't want you to have more than 3. And I was like, no, I like you, but if I ever get pregnant again, I'm leaving this practice and going somewhere that will support me in a VBAC.
Right. And
so the fact that you think how many people are they telling that to?
Right. And you're making a decision for me. And then there's so many people who really, in their minds, believe that the doctors know the best and that they have to listen to what they're saying, which is not true.
You don't question it. You don't question it. They have the degree. Why would I question the person that has the more education than me?
So not even in regards to a pregnancy at the time. I was actually, and this is not part of the reason why I became a doula, but while this was around the time I became a doula, I'm sitting in a doctor's office and they're explaining to me why I have to have a medical surgery. And they're saying, well, we have to remove half of your cervix because you've had this issue in the past. And so we're just going to fix the whole thing and we're just going to take off your cervix. We're going to take off half your cervix. And so they explain that after they do the procedure, that I won't be able to have any more kids. Like in my heart of hearts, I understood that I wanted 2 more kids. And so at least 2 more kids. And so they were like, well, you already have 2. What do you need anymore? And so this is that position where there's someone else making decisions for my body based off of what they perceive as their education and their knowledge base. And so the issue was I had abnormal cells that were growing on my cervix. And so they were like, well, this is absolutely going to turn into cancer and you will die before your kids, mind you, I have a 1-year-old and a 3-year-old, before they reach 18. Okay, so here's the thing, like I had already had abnormal cells and I knew that they had previously gone away after a pregnancy. I don't recommend that for everybody else. Like this was my experience. And so I tell the doctor, hey, this is what's happened to me in the past. Is it possible that it would happen to me again? And they were like, no, they absolutely will not go away. You will die of cervical cancer. Fast forward into that meeting and they asked me like, hey, do you want, I asked them, well, will you do a pregnancy test? And they were like, well, are you trying to get pregnant? I'm actively pursuing another pregnancy. They come back 45 minutes later with a positive pregnancy test. You're pregnant. After that pregnancy goes by, it turns out that those abnormal cells left. And so they would have, and then I went on to have 2 more kids. And so like they would have made a decision. They would have made a conscious decision for my life, for my family, for my legacy, for the generations that come after me, based off of what they didn't know was possible. And so this is where we get into like how I'm a level with you, like how we're being controlled, how we're being manipulated, how our communities are being like geared in a certain direction and stuff like that. It's very important that it's us who makes the decision for our body. You know what I mean? Like, right. But you know, like, and you know, and the biggest thing is that we have to accept the risk. A lot of times what I've experienced is that the medical profession will put it on us like, oh, well, are you willing to accept this risk? And nobody wants to accept that risk because it's scary.
Right.
Yeah. But like, and at the same time, you know what I mean? Like, are you comfortable with their decision for your life and stuff like that? So I am a doula because I want people to be able to make good decisions. You know what I mean? Right. And not every, like, look, I would never suggest somebody like, hey, those cells go away. Look, make a conscious decision. Make a conscious decision of everything that's before you and stuff like that. I'm gonna stop talking because I want to hear what Nurse Ev had to say. Why are you a doula, ma'am? Why are you a doula?
I agree with that, Jen, because that's literally a main part of my life why I became a doula, because I didn't just wake up and was like, oh, I'm a doula. Like literally, where I'm from, it's a small rural town in North Carolina, right? It's like factories there and stuff like that. That's just kind of what you do. This is where you go to work. It's literally like get a good job, work, and this is your life. Have kids and get married, right? This is like your life. And so although I knew I wanted more than that, I was just always groomed that you're going to go to college, because I was a straight A kid, and that's just what straight A kids did, right? Where I'm from, they just, go to college. No plan. Mind you, I'm a first generation college graduate, which means I don't know what I'm doing when I get to college, right? I'm trying to navigate this whole thing, and it's just different. I made my first C when I got to college. I didn't even know how to even navigate that whole thing and how to get help, tutoring, whatever's the case. It was just trying to like get through like everything and trying to understand. I also had a foreign professor. I'll never forget it, because I had like 4 A's that semester and D in that class. And I remember my advisor at the time, who I was told your advisor is who you go to. They advise you on what classes to take, what not to take. My advisor said, because I was pre-med when I went to college. I was going to be a pediatrician. And my advisor was like, you should probably try something easier like nursing. Mind you, I had 4 A's. I had an A in the physics lab, but I had a D in the class because I didn't understand. The professor was foreign. Everyone failed the class. The next semester, I see all my other people in the class, and they're like, Ebony, why are you not in the class? And I was like, I didn't know I could retake the class. Again, I'm a first-generation college graduate. I don't know. I don't know these things. So I'm kind of now on this whole path to like being a nurse, unknowingly, because that's what the advisor said, you know, I should do. So I'm navigating that thing. I become a nurse. I'm definitely one of those people that believe that, you know, God has a path for us all and we get there how we get there. However, I feel like I've been doing doula work for so long. My first encounter with it was when I was a teenager. My best friend, my god sister, she was a teen mom. She got pregnant at 16. And I remember being in the room with her, and I'm just like, you know, patting her head, and we're just like going through everything. And I even remember one time she said, Eb, I feel like I got to throw up. And I'm like, okay, wait, let me go get a bucket for you. Like, let me see, you know, try to help you. Funny thing is, we know now that's a good sign in labor. But I'm just, you know, helping her going through the motions. You know, fast forward, I'm a nurse now working. Life is great. I'm in the adult ICU. I walk into work one day and someone's like, Ebony, you have the patient pregnant and they're going to induce her for labor today. And I was like, okay, great. Let's have a baby in the adult ICU today, right? Cool, no beans. They always send a lot of maternity patients over to our ward. So literally, that was like my first assisted delivery in the hospital. And I remember saying to myself, there has got to be another way. This can't be the way labor has to go. It was a disaster, critical care unit, patients on the ventilator. It was just everything that you can imagine and not the way that I would like it. But that's when I became fascinated with NICU, because the NICU nurses came over, picked up the baby. And so fast forward, I'm just still kind of a little fascinated with more like neonatal ICU, some L&D stuff, not a whole lot, because that little experience was a little traumatic. But I started tapping into it more and more and more. Honestly, I was just kind of fighting it the whole way. But I'm really big into maternal health. Started to doing a whole lot more research about fibroids and endometriosis and PCOS, because as I get older, I find that I meet a lot more women with these things. And I also think back to when I was a young girl, my mother had a hysterectomy, partial hysterectomy at a young age, because her doctor said that she should have it. I honestly, now that I'm older and I know better and I have more education around it, my mom didn't have to get a hysterectomy, but like Jen says, she was told that this was her option and this is what she must do. And as a nurse, I've been a nurse for 16 years. I've just always noticed that people have always made decisions because they were either misinformed or ill-informed. And I think back to my very first major decision that I made because I was misinformed and ill-informed. I just didn't have all the information to make an informed decision way back in college. And then fast forward to working as a nurse, I see so many people who they are either coerced into a decision, they're manipulated into a decision, or they make it because they just don't know any better. And the doctors, unfortunately, know that they have that authoritative power to make people feel like they have to make the decision that they feel that they should make. And so just watching that for so long. And then, but the turning point was, I remember finally getting more into Black maternal health, because of course I'm a Black woman. I started to be in like childbearing ages, and I'm looking at a lot of different things. People are dying, and I'm like, wow, what's going on? I get really heavily involved in it. I'm still heavily involved in it, advocate, but I end up starting real heavily into doula work and start certifying, doing the trainings. And I remember working with my niece. My niece was also teen pregnancy. She was 17 years old. And I remember seeing her at home one day, and I said, you need to go to the doctor, because you're all of a sudden like you're swelling, you don't feel good. She was saying that, you know, her pressure was starting to rise at a previous visit. So she go in, they tell her, oh, you're fine, that's just normal swelling in pregnancy, you'll be fine, whatever. 2 weeks later, she's at her routine prenatal visit. She has preeclampsia. She had preeclampsia 2 weeks ago, but they just told her she was fine, whatever. They send her in for emergency induction. They're like, you need to be induced, this isn't gonna work, your baby's not gonna be fine. Baby during this time was never stressed, never had an issue, no heart rate dropping. Baby was fine, but they were so focused on her blood pressure. I have a friend that's a nurse practitioner at a high-risk OB clinic. They manage preeclampsia all day, every day. That particular facility just didn't know how to manage it, so their decision was, we're going to induce you. versus saying maybe we should send you somewhere to get managed. Fast forward, she goes through induction. She has her baby at 34 weeks. I finally make it because I'm flying from LA. I get there. My niece is there. However, she just looks so like out of it. And they kept telling me, oh, she's fine. She's fine. It's just the magnesium, because I'm there like right after birth, and I'm just kind of like, So I'm watching her the whole time. I'm asking them to draw labs. I'm telling them she doesn't look right. Something doesn't feel good. And it's still kind of like, she's fine. It's just the magnesium. She's fine. Mind you, I have been an adult ICU nurse for years at this time, just transitioned to NICU. They didn't know that. So I'm looking at them like she's running magnesium at 2 grams per hour, which is a high dose. In the adult ICU, we give you 4 grams, and then we'll draw lab work before we give you any more magnesium, because that's how strong it is.
Yeah.
So I'm watching that. I'm watching her. She's starting to become more and more lethargic. She becomes more and more non-responsive. I'm a nurse, so I know I'm doing assessments. I'm checking her reflexes. I'm looking at her pupils. I'm seeing if she's doing any movement. During this whole time, I'm like, you guys sure you don't need somebody to come and take a look at her? Everybody that comes in, every provider, every nurse, I say, do you guys know what her last magnesium level is? No one can tell me her magnesium level. But getting a magnesium level, guys, is as simple as logging into your computer, going to look at the labs, and telling me the lab level. That's how easy it was. So finally, I was like, they can't have a magnesium level because it takes 2 seconds to tell me what it is. So you don't have a baseline magnesium, but you're running magnesium continuous through IV infusion, which means going directly into the bloodstream. Right. So I'm continuing to say, okay, we need to get a doctor to come see her. I know you guys need to do lab work because something just doesn't look right. So she's becoming worse. So finally I said, she needs some lab work done, because she can't even hold up her head at this point. She can't even do anything. They're just like, oh, but she's probably just tired. Well, they get like that. She probably just doesn't want to, she just doesn't feel like doing anything. And I'm like, no, you need to check her. Finally, I get an order for the lab work. The nurse comes in and she says, and I quote, and I will never, as long as I live, forget this. She said, we have to poke you for some blood because your family thinks something's wrong with you. That's what the nurse said. I didn't say, of course, I want to flip, but we're in this society that if a Black woman says anything, I didn't want to be the angry Black woman. I didn't want to be the aggressor, because at that point I may be asked to leave, and then who's there to advocate for her? Okay. So I had to just kind of bite the bullet, bear down. And I said, okay, let's just get this lab work drawn. The nurse really didn't want to do it. And she was like, well, I don't know if I can see any veins. And I was like, no, she has one right there. Like, you guys can draw the blood from that one right here. So we get the blood work. So an hour and a half go by. Stat blood work is 60 minutes, guys. No max. No lab values yet. What's your lab values? Mind you, the whole time we're waiting for the lab values to come back, it's just infusing. Finally, a doctor comes in and he looks at me. He's like this. He says, how does she look to you? I said, she looks terrible to me. How does she look to you? He was like, yeah, she doesn't look so good to me. He does a full assessment on her. He finally checks the reflexes. That's something that the nurses had not been doing, which is important with magnesium. Because when the levels are too high in your blood, you lose your reflexes. That's like a first indicator. Fast forward, guys, they finally tell me the lab values, right? It's 9.4. I knew it was high because when they came in, they was like, oh, the doctor told us to stop the infusion. Not slow it down, not cut it in half, stop it. Turn it off completely, took everything out. Her magnesium was 9.4. Normal magnesium is 1.5 to 2.5. Even if you're dealing with preeclampsia and we're treating you, it shouldn't be higher than 6, 7 like max. So now we're heading into magnesium toxicity, which means she can suffer from a cardiac arrest. And all of this was preventable had you just listened to the family, had you just did your assessment. Had you did a basic assessment, you would have known that. And for me to be a nurse in that moment and feel so helpless, it was literally the turning pivotal moment of, I'm not going to cancel that training. I'm going to finish it because I need to get in here and I need to make sure these people are okay, that we can save their lives. And like every time I think about it, I think about how just dismissive they were about what was happening and what I was asking. And the next morning, the charge nurse, the nurse manager, and that nurse that night, they all came in together and was like, we wanted to talk about what happened last night. And the charge nurse says this, and I was the charge nurse up there and I didn't hear anything about this. Like, total attitude, ambushed the room. So then I had to let everybody have it at that point. Let them know what was going on. This is how you didn't. Was not correct. This was all the disaster. I'm an adult ICU nurse. You don't know that, but you do know now. And what are you guys going to do about it? And then it was a totally different attitude of like, oh, we're sorry, you know, we didn't know, you know, we were, we don't, and they kept saying, well, we don't usually check a lab value unless they're showing symptoms. And I was like, what y'all want to do?
Die.
Cardiac arrest and die before you do something? And so that was like really the pivotal moment, because it showed me that no matter if you don't want it to be discrimination or if you don't want it to be neglect, it really is. And somebody has to do something about it. And so that was like really my pivotal moment of like, my niece could have died. My nephew would have been here without a mom, all because people just felt like she was just being lazy. I mean, I know she was a teenager, but there was something wrong with her, literally something wrong. And if they had done basic assessment, then they would have known that. So that's literally why it's just, people don't know how to advocate for themselves. They just don't have all the answers. They don't always have somebody there, and they don't always know what to look out for. And some people just don't care. Some people think you're lazy. Some people think,
and I think that's the challenge. I think that's the challenge in our, the way we look, I'm gonna break it down like this. I think that's the challenge in the way we do life, right?
Yes.
Because something as common, as natural as giving birth, we make it to be like this far off thing. Like we can only give birth, like we're only designed to give birth in hospitals. And so what happens is we take the natural function of a woman's body and we, check this out, and we outsource it. So we give it to somebody else and we say, hey, you take care of this. But the problem is that they, like, there's a system, and it's not a negative thing, but there's a system at work and stuff like that. And the system says you come to us for all of your needs. But from that perspective, if we come to you for all of your needs, the things that we're supposed to own, we don't own because you're supposed to own them. But then you say you can't own them all, because how could you possibly take care of me and everybody else at the same time? So it becomes this discrepancy that we get poor care because everybody needs the care. But when you take, exactly, it's a paradigm shift, right?
Yes.
And so when we take that truth, like, hey, look, they can't give me and everybody else good care at the same time. Like I have to own what's mine to own, and all of this and this baby is mine to own. And so yes, I like me, all my kids, I have 4 kids, all of them were born vaginally, all of them were born without meds, and at the same time, I've also experienced like great hardships in the birth room because of my choices not to go in line with their care and stuff like that. And so I am a doula so that I could give people so I could give birth in people the tools they need to own what's theirs. You know what I mean? Like, this body is yours. Like, when you talk about trauma in the birth room, when you talk about almost dying in the birth room, that stuff is scary. And like what Nicole mentioned earlier is that's the stuff that makes you shift on whether or not you'll have kids. Now, check this out. I'm going to go there. So we have abortion clinics on every corner in the hood. And then we have doctors in the birth room who are like setting us up so we do not enjoy our birth experience. And so what comes out of your mouth, I'm never doing that again. I'm never doing that again. So where does that put our numbers? You know what I mean? Like when we talk about like Black kids in the world, you know what I mean? Like, where does that put our numbers? And then the way, like, not just the mentality, but the posture. The posture, the power, that a woman births in, she raises her children in. And like, we could debate it and stuff like that. But if you have a bad birth experience, like, it's not always, it doesn't always lead into like this really positive postpartum season. You know, like Nicole mentioned earlier, I went into postpartum depression after my second C-section. For me, I went into postpartum depression after my first labor because I got an episiotomy because my body went into a lull. Like, if you understand birthing and stuff like that, there are some times where the contraction patterns will pause.
Yes.
And it's an opportunity for mom to get her breath, for her to get clarity, for her to jump back up on that horse. My body went into a lull. It did not contract. The midwife, check this out, the midwife was telling me to push. I didn't know what to push. I couldn't push. There was no contractions for me to push. Somebody else walked into the room, cut me real quick. Baby came out. And and I had to deal with that. I walked away from that with a traumatic experience, and everybody's like, oh, well, your baby came naturally, your baby came vaginally. In my head, I could not comprehend that I was not able to protect myself or my baby in that moment. My baby came out, they were perfectly fine, but I felt the fear of what the heck just happened to me, because I like, in my head, like it's burned onto my memory watching that image, like as it was all going down, and I could not protect myself. And so like birth actually has a greater capacity to change lives than people recognize or people are willing to admit
or allow. Because when birth trauma is real, and I've heard, you know, people say, you know, well, I'm just glad I made it out alive. Like, that's just not enough. That shouldn't be enough. That shouldn't be the goal to make it out alive. Like, everybody deserves to have this blissful moment and experience that they can have if somebody doesn't take it away from them. And birth trauma is real. Maybe you made it out alive, but you probably have suffered a lot of birth trauma. And birth trauma is transferable. Like, that I went through with her, that transferred onto me. Like, I literally had so much anxiety from that about birthing in the hospital. I was like, yeah, I'm gonna be home. Only because I understood in that moment that you can almost jump up and down to try to get something done and they will still ignore you. And
okay, but before you go any further, so I want to address something in the comments. It says that this is scary. Look, so that's not our heart posture. Our heart posture and our intention is not to pump fear into our communities. Like, as doulas, our heart is to inform and to educate. So understand, absolutely, scaring and losing a mother or a child, that it's horrifying. Sure. You know what I mean? Like, I have to have that conversation with my husband. Like, if we plan on having more kids, like, hey, is this something that we're willing to do? And so, and at the same time, the fact that it's happening, nobody's addressing it, it leaves our community vulnerable for it to continue to happen. And so we have to have the conversation in order to put in place the guidelines, the restrictions, the education, the power, the, you know, everything that a woman needs so that they can journey through the season in power, strength, and resilience, so that if bad things happen, they understand how to overcome them, but they also know how to avoid them. And so, and you said it's scary, not for Black women. See, and that's the thing, like maternal mortality is affecting everybody. It's affecting everybody. The unfortunate thing is that it's affecting Black women more. You know, like I live right outside of DC, and like we lose 40 women every year. You know, next month we're going to go into more detail on maternal mortality and stuff like that. But yeah, we lose 40 women every year. So that's a little bit less. That's a little bit more than 3 women a month. No, it affects Black women. Yes.
That's what you just said.
It absolutely does affect Black women. It absolutely does affect Black women. And when you look at the numbers of the women who are dying, and that they don't have to die, and that's the thing. Like in Eb's niece's situation, like that was a completely avoidable situation. And of course, she walked away. You know, she walked away from it. But had Ebony not been there, that would have been a different outcome and stuff like that. And we had like last year around this time, there was a story of a young lady. I believe she was from New York. I believe she was from the Northeast. I can't remember what area exactly and stuff like that. But she was a doula. And she died giving birth. You know what I mean? Yep. Like, and I've had that experience. Where as like, I'm fully educated on what goes wrong in the hospital, and I can't help but go on their landslide of craziness. You know what I mean? And I'm pushing back, and it's hard to get off it. Like, once you get on that slippery slope, like, where's the end? You know what I mean? Like, you don't want anything bad to happen, but then how do you stop it? And like me personally, I always feel like the very first thing you put in place is education. Always education. The next thing you put in support. In my situation, I didn't have the proper support because it was just me and my husband at the time. And so I didn't have a doula on my side to talk me through different positions, to talk me through different things. Because in my head, I'm like, I'm a doula. I got this. I know how to birth. You know what I mean? I got this. I can do this. And when you're in the middle of it, all that doula brain drops right out the pocket. And you go into survival mode. And that's what a lot of women are experiencing in the birth room, and it shouldn't be so. When a woman goes into survival mode, she's just flowing, like she's just trying to live at that point. Yeah. And on the day of her child's birth, it shouldn't be a conversation of whether or not I live. Mm-hmm. And that is what a lot of women are experiencing. Again, why we doula. What you got, Nicole?
Man, I was sitting over here thinking that before we even got on this call, you said, oh, this week has been a rough one, and I don't know. And then I'm like, Jen is bringing it all. Like, what did she, like, power, resilience, and I'm like, whoa. So yeah, no, I don't even know what to add to that, because I'm right there. Like I'm right there with it. I feel like anything I say goes into the whole maternal health, Black mortality, women of color 3 times is more, dying than white women. So I'm trying not to go there, because I know we're planning to go there. Next month. Yeah. So, I just think, at the end of the day, I get a lot of what you just even described, or even what Ebony's talking about. Like, people hear a lot of these horror stories, people experience them. I just got a call last week, and somebody was saying, they went to the doctor starts mentioning high blood pressure, preeclampsia, and they're 34 weeks. I'm terrified. What do I do? How can I retain you right now? Like, what, and everything else. And just like talking through and having just to calm down them, because they literally had just walked out the doctors and all they did was Google, doula in Charlotte, and boom, I'm calling you. Can you help me? And so really like hitting on all those fears, and just, making sure, like, the end of that conversation, I was telling her, like, the thing is ask all the questions. Never feel like you can't ask the questions, because they slate those doctor's appointments and you're, 20 minutes and, they're trying to move you in and out or whatever. I'm not a number. Ask the questions. It doesn't matter if it takes 25, 30 minutes. Ask the question or whatever. This is my life. This is my baby's life. So these are the things that, people feel like, like you said, you just have to listen because it's the doctor. You just have to listen because, they have the knowledge that we don't have. And I think, one of the things I always tell people is, in addition to that knowledge, they also have liability. So they're always trying to protect their ass. Let's be clear. Like, you know what I mean? So the things that they do are not always in line with what's best for you, but it also is what's best for them. So making sure that, that you actually have a say so, in everything that's happening to you in pregnancy, that's happening to you in birth, that's happening to you, in postpartum. If you can speak for yourself, and if you can't speak for yourself, sort of like, what Ebony was saying, having somebody who can advocate on your behalf, because if you hadn't been there, who was going to be able to say something is wrong, or if you had just sat down and said, okay, well, the nurses know best, or the medical staff knows best. Like, you had to ride them in order for them to even make a move. And it was hours later, and had you not been there, then the whole conversation could be a whole different, conversation in this moment. So I think that's the thing, is just the education and the advocacy, and just, making sure that people are informed and knowing. You can ask as many questions as you need to ask until you feel comfortable, you feel at peace, your gut is okay, your intuition, is good, and there's no, question marks like what if, or should I, or, any of that stuff. If it's not an emergency, that's how I always look at it. Like, if it's an emergency, you can't ask too many questions. But if it's not an emergency, make sure that you know what it is that's happening to your body and to your baby.
Yeah, absolutely. I think so one of the things that Eb has said before is the continuous support of a doula. In
Right.
reference to what you were talking about, you said ask all the questions. I think the problem is that a lot of times women don't know what questions to ask. You don't know what you don't know. And so
Right.
when you have somebody who's providing continuous support, and me, like I'm a doula, I'm a childbirth educator. I love going along for the journey and stuff like that. And I go along the journey so that I can feed those questions.
Right.
to you, hey, make sure you ask this question, make sure you ask this question. And so from that position, like moms are able to, oh yeah, I didn't think about that. I didn't think about that. You didn't think about it, because they're telling you what to think. You know, you go in, they draw blood, they take, you know, they might do a urine sample, they might check you and stuff like that. And they're like, oh, everything is fine. But they don't really communicate to you what's happening. You know what I mean? Like, you don't really know what's happening inside your body or what they're seeing on their results and stuff like that. And then being able to formulate questions like, oh, okay, so at this time I should be experiencing this. Well, what does this say? You know, another thing, Eb, you mentioned that earlier, advanced maternal age. You know what I mean? Like, just because you're older, you know, like we get put into this box like, hey, look, your uterus doesn't work. It's going to dry up and turn to dust. And so let us help you. Let us help you. Let us do all the things to save your life, and recognize it, and giving women their power back. Look, like I'm so excited, not just to be a doula, but to be a woman. You know what I mean? Like, in this season, it is so important that we are mindful as women to understand like what we are birthing into the world. You know what I mean? Like as women, we always go through seasons. Like we're continually in seasons of conceiving and birthing. Like, we are outrageously powerful, and we affect change in the world in such a dramatic way that it's important that we are mindful about what like seeds of negativity, fear, and, you know, and anger that we're birthing into the world and stuff like that. And that doesn't always have to be like in a physical form where I'm birthing this baby and stuff like that, but in the natural, like where is other people's toxicity leading us? Like, we're making decisions. Like, we all gave different examples of how like other people's decisions for our life led us in a direction. And should it be, you know what I mean? Like, should other people's like decisions for like how life should go, you know, for us really affect us to the degree that we're altering the decisions that we make for our own life and even for our own family, you know what I mean? Like, for my situation, like, you know, like a doctor tried to tell me I couldn't have any more kids. Like, no, this is just not for you, you know? And they've actually told me that several times on my fertility journey and stuff like that, where it's not a possibility. And had I believed them more than I understood more than I understood the power that was already resting on the inside of me, like my life, my legacy would be completely different. You know what I mean? Like, I wouldn't be serving the community in this way because like I would have been shifted. I would have been altered in a different direction.
Jen, you said something earlier about like, you know, women, like we're like powerful. We're like, you know, I think what I have to let women or any birthing person understand is that, so do you really believe that you were given this gift of being able to create and sustain a life for 10 whole months? Like, you literally create another human being in your body for 10 months, and you think that when you get to the time to birth that you can't do that? So you can create this life for 10 months, but you get to birth and you can't do that. There's not even any way possible that you would be given this job that you can't complete. It's not even possible. And honestly, the journey is that 10 months. We get to birth and we're going to get baby out. But it's that entire 10 months that you had to go. Your body was literally made for this. If your body wasn't made for it, you wouldn't have a uterus, you wouldn't have ovaries, and you would not have fallopian tubes. And so the system has unfortunately taken that power away from birthing people and made them feel like, yeah, you can get pregnant, yeah, you can hold your baby, but when it's time for birth, you have to come here and let us do it for you. And that is such a false reality that we have just been fed for so long, and we have been conditioned to believe, unfortunately. And so that's where we come in with education, information, tools, resources to help you to understand, like, no, you can do this. And like Jen was saying earlier, we're not trying to perpetuate fear in our community. Absolutely not. But we want to inform you so that you take your power back. Like, it's been lost. It's almost like it's just floating out here. And it's like, no, take your power back. If I could create a birth, if I can go through conception, right, I can sustain this pregnancy for 10 months. I'm literally creating a human being, because not only does your body sustain this human being for 10 months, it does it because it creates an entire new organ the placenta to feed this new human that is created for 10 months. And you mean to tell me we get some birth and no, you can't do that? I need to help you do this. You did this for almost a year, but you didn't need help with that. No way possible. What has happened is it's conditioned us to believe that we need help with the birth. No, you don't. Right. The birth, once you get to birth, it was like nursing school. Going through nursing school was the hell portion. Getting to the NCLEX was like a breeze because I had to go through so much. So it was like, no, you can totally like do this. And it all starts in your mind, literally, so that you got to understand and know that you can actually do it and make it happen. And more women, whether you're Black, Puerto Rican, Haitian, Asian, like understanding that you don't have to be afraid to have birth. Birth is really such a beautiful process. It's when the process is disrupted that it becomes ugly. Like literally, birth should be undisturbed. We should leave it alone. Even the due dates. I was just speaking with a doula sib last week. It was funny because we were joking about it, but we were also annoyed that this woman's due date was off by 3 weeks. That's a big deal when we think that you're 37 weeks or 41 weeks or 40 weeks. Like that's a big deal. And so understanding that these people that you're dealing with, they're humans too. They make mistakes. 3 weeks is a bit much, but hey. Like, that's what I'm saying. So, like, and then the issue with the due dates is that women get so stressed out. And then the doctor stressed them out because they're like, oh, you passed your due date. We're going to have to induce you. No, you don't. No, you don't. The baby's not come yet because it's not ready to come yet. And who knows, maybe his due date was off. And so it's such a manipulation of how we want things to go. I've been a nurse for 16 years, guys. Let me tell you what they teach us all the time. We go over this all the time. Discharge starts on admission. That means when you get there, they're already working on when they're going to get you out. It's not this old beautiful haven of like, let me just sit here in the lilies for 3 or 4 days or however long that I need it. No, like they have a plan. You have a plan. You got to always remember that. And we're talking about this next week because we really don't have time. But even the whole psychology of white walls, the white walls in the hospital and what that does to your mental when you walk in there. It's
look, I don't even understand that. We're gonna have to talk offline about that because I'm interested. Look. Before we go anywhere, check this out, Eb. I wanna say something to what you were talking about earlier about like how the woman's body, we grow a whole new organ. Listen.
Yes, we do.
My soft tissue builds bones.
Wow.
You can't tell me I'm not amazing. You can't tell me I'm not amazing.
Are you in the Matrix?
I am in the Matrix.
That is
soft
like
tissue builds bones.
It is that is phenomenal. Even when you talk about like pregnancy and sustainability of pregnancy and like so many other things that we can do to help sustain it. I remember my client, her iron was low. And you know what? They said, well, my labs all look good, but they said my iron was low. I said, what was the number? They didn't tell her the number. I said, well, what does look good mean? Because not to be annoying, but to get her to understand like what questions to ask. If a doctor says your labs look good, just say, what are my numbers? That your labs look good is not a good, that's not a good answer. Even with iron, like drink some nettle tea. Like don't take an iron supplement if you don't want to. There's so many other ways to increase your iron. There's so many foods you can eat. There's so many other things that you can do, but you guys gotta understand we are in Western medicine society. We are conditioned to treat versus prevent versus look at other alternatives. And a real quick story, my mom went to the doctor the other day. She was having issues with her blood pressure. And it was such a beautiful learning lesson for her because I've been trying to tell her this forever. Listen, when you're a nurse or you're in the healthcare field and you are someone's daughter, you are their little 5-year-old daughter, okay? You're not this health professional. And we're sitting there, and this doctor gives her this whole spiel about 3 medications she can take for the indigestion. It may be gallstones. Later, she can have a surgery consult, get her gallbladder removed. Just like 20, 25 minutes. Then I say, she's done. She says, oh, I'm finished now. Do you have any questions? I said, or she can just change her diet, correct? Oh, yeah, you can change your diet. No fried foods, fatty foods, foods high in cholesterol. And later, I talked to my mom. I said, I'm so glad that happened because I wanted you to understand and see how she spoke to you for 20 to 25 minutes about 3 different pharmaceuticals, medications, a surgery that you can have.
And a surgery.
And it was not until I intervened and said, but she could also change her diet. And we're talking about the gallbladder here. That's pure diet. That's pure diet issues. And so it's just showing you like a lot of times a lot of the providers, this is just what they know to tell you because they don't know they don't know anything else. And it's funny how they call plant medicine alternative medicine. This has been here. Plants have been here since the beginning of time. What we're doing is the alternative, and it's also altering our bodies, which is such an issue with women with reproduction and creation and those things. So that's why I'm just so passionate about holistic health. I'm passionate about people, women everywhere getting this information, because when you're creating this life and you're trying to sustain this life, you want to know how to protect your organs, how to strengthen your uterus, what are the things that you can do. And also women, one thing they're not doing enough of is preparing their bodies before they even get pregnant, so that you can have a healthier pregnancy to sustain, you know, this baby. But we just want you guys to understand, like, birth can be beautiful and it is gonna be beautiful. We don't want to perpetuate fear, but once you guys understand education, information, that is your power.
Preparation. Committing yourself to preparing for birth.
Absolutely. And understand that that's okay. Like, you can prepare for birth. Yeah. You can prepare to get pregnancy. You can prepare your body. You can prepare for all these things.
Don't you prepare for anything that's big in life? Oh, I'm going to get married. What do? You run out, you create this whole plan. You got wedding books. You got all this stuff. You prepare. Oh, I'm going to go take a class. I got to go take a test. I'm going to get a new job. I want to get to this promotion. You're doing all this stuff to prepare. Why is it when I go to have a baby, I'm just supposed to sit back and wait for somebody else to tell me what I'm supposed to do for the next step and the next trimester? And then, oh, now when you get to the hospital, tell me what's next. No, prepare.
It's everything. Two clients that stand out to me the most are the two clients that did a lot of preparation with their breath work. And to see both of them in labor, it was just phenomenal, because you know how their breath work is. It was just so amazing to see them. And my last client, it was so just funny to hear her say, oh, the first thing that she wanted to know as soon as her baby came out was, did she rip? And she didn't rip. I had her doing the whole coconut oil lube throughout the time. And also the exercises on her body, like literally those hip opening exercises, are everything. The squatting is everything in that breath work. So literally, like, doing all of that all throughout the pregnancy. So by the time you get to birth, it's like training for a marathon. That's what I say. You train up for this big day, and you're a rock star on your big day.
And I think the challenge with it, as we close and stuff like that, I think the challenge with it is that because we haven't heard anybody talk of birth in this way, that we feel like am I doing too much? Am I doing too much? Does it really take all that? You know, because I'm just gonna go get the epidural anyway. And we don't realize that once we like we fixate our mind in that direction and stuff like that, it takes us on that journey of slippery slopes, and it puts us in harm's way because we haven't heard a different conversation concerning the matter. And so that's why it's so important. Like I go live every day on Facebook and stuff like that. I'm always talking about it. I don't know if everybody hears what I'm saying, but I know that when it comes time that they're going, like the people who do hear my message, that they will have a different consciousness concerning the matter, because now they have conflicting thoughts. Now they have, like, this is what culture says. I don't know, but I heard Jen saying, this is what culture says. I don't know, but I heard Ed saying, this is what culture says, but I heard Nicole say. And now it becomes, now we journey through the gate where it says, like, I'm going to take in information from both sides and I'm going to create my own path. And I think, you know, it's manipulation and control that says, no, you don't get to choose for yourself. You just do this. And that's not healthy. That's not how we should live. And that's, So in line with what you guys were already talking about, affirmations. Where do you stand on affirmations?
I think for me, one thing I'll say before I go to affirmation again, because you said something really amazing about, like, you're on every day and someone can be like, well, Jen said, the one thing I think about is Tupac said, I may not be the one to change the world, but he said, I guarantee you I will spark the brain of the one that starts it. And that's how I feel about this work and this information. And as far as affirmations, let me tell you, affirmations are everything. And I believe in it. The more and more I study affirmations and the more I study the brain and how it works, affirmations are everything for not just your life and birth, but for just day to day. Because literally learning how when you have a negative thought, you create a protein branch in your brain, on the surface of your brain, and it has like plaques around it. But then the positive thought also creates a protein branch, and it's like a more healthy looking protein branch. Like you guys can get into like some neuro work, and you can look at it and you can see, and it shows that what the negative branch does to the surface of your brain, like how it creates plaques and different things. So basically stuff that's not good. And so it was just amazing to see that it literally manifests in your brain, and how you can change that, how you can change the narrative just by speaking these positive affirmations. Because also what I learned is that your brain doesn't know what's real and what's fake. It's like it doesn't know the reality from the fantasy world. So you can, say this positive affirmation, and it makes you feel really good, like you're releasing endorphins. And that's amazing because your brain feels this and your body reacts based off of that. But it's also the opposite if we keep doing negative self-talk and we don't do these affirmations. And sometimes you feel crazy doing it. Don't get me wrong. I'm running around, I'm saying my affirmations, and sometimes something may feel like, girl, you just spewing words in the air. This is not real. But you have to push past that. You have to literally continue to say your affirmations, because the longer you say something, the longer you hear it, then you start to believe it. You get it down in your soul. So I am an advocate, huge advocate of affirmations. I say them daily, throughout the day too. Even like if there's a moment that I need it, I feel like I got to go ahead and say it. And so like, I think they're phenomenal, but especially for women in birth, because it helps them to bring their power back, but it keeps their mind in a great mental space. Because when you're stressed out, you're anxious in birth, all you're going to focus on is the pain. You're going to go towards the pain instead of pulling yourself away from the pain.
Absolutely. Absolutely. What about you, Nicole?
I'm sort of on the same line, like affirmations, positivity, all of that stuff. When you were talking about like creating the negative branch and the positive branch, the thing that came to mind is what is the definition of disease? Dis-ease. Like, how do you get disease? Like, it comes from uneasiness. It comes from negativity. It comes from all that stuff literally weighs on you. It weighs beyond, oh, I just had this negative thought, or, oh, people who wake up and say like, oh, I'm not a morning person. What is that? Like, you're literally feeding yourself a negative thought that carries on for the rest of your life. And as you have these negative thoughts, if I don't wake up, I'm not a morning person, then I wake up and I'm having a bad day every single day. I can't move. I'm running late. You're stressing. This is all stress. I'm putting it on my body. I'm putting it in my mind. I'm putting it on my organs. Then it channels out to other people. Like, it just keeps going. So if I just change, what's an affirmation? It's just repetitive, positive thinking. Like, it's a very simple thing. If I wake up every day and just say, today's a good day. I was listening to something, I can't remember what it was, but actually, it was Coach Yolanda. She said, she was going through some stuff, and she said, people would ask her, and her answer was always, I am well. It didn't matter what she was going through. Her answer was, I am well. And since she said that, I started doing the same thing, because like, whether I'm well or not or whatever, I'm speaking that into me. I am well. Thank you. I'm always well. I'm here. I'm above ground. I'm alive, and I can always do better. So, when I think of affirmations, like you said, like definitely something that is life changing. Because if you can just change your train of thought, change the way that you're thinking, and how your brain is receiving all of this information, then unbeknownst to you, usually you're clearing out all of this like sludge that we carry in our body. You end up being lighter in all areas, and you end up being able to fix the things that at some point probably seemed a little unfixable. So I just think, that positive mindset just creates such a huge change just in all of, who you are really. And then it actually, by the time we see something on the outside, by the time you see high blood pressure or, diabetes or cancer, any of that stuff, it's already creating this whole thing inside you that you didn't even know was going on. Like, you have all this internal junk that was happening. And now, now that you finally see it, you know, you go to the doctor and they say, oh, well, you have stage 3 cancer. Well, what happened to stages 1 and 2? Like, I didn't even know it was manifesting in my body. You know, that disease is continuing on and you don't even know it's internal. So if you can start that internal positive change and thought, then it will literally change your whole trajectory in life.
Absolutely. So with that, like the way we journey through pregnancy is the same thing with those affirming words, but those affirming words, it's not just for pregnancy, it's for your postpartum season. And so like when I work with my clients and stuff like that, I always get them started with their affirmations early. Like, hey, let's get these affirmations rolling, because when we're in labor, these like, and I give them some, and then I let them make up some of their own. And then when we're in labor, I start repeating them back to it. I start repeating them back to them and stuff like that. So they have a positive place to go to, like apart from experiencing like their surroundings and stuff like that. Recognizing that fear actually brings down our immunity. Like fear will actually make us sick. So all of 2020, all of 2021, you know what I mean? Like the more we stay in a fearful posture, and I'm not saying be ignorant, but the more we stay in a fearful posture, the more open we are to getting ourselves sick and stuff like that. And when we go into labor, you know what I mean? Like the more we stay in a fearful posture, the more what we're doing is we hold our muscles tight. We hold our muscles tight because we can't relax because we're scared, right? And so like we hold that baby in, which then turns into failure to progress, which then leads into X, Y, Z, you know what I mean? Like whatever intervention that you're looking to avoid. And so like that posture of affirming yourself, affirming your body. Birth is natural, normal, healthy, and safe for me and my baby, you know. And as a doula, like I'm a mega nerd because I always wear positive affirming words when I go into a birth, you know. Like I used to wear just like casual clothes, and I'm like, no, I want you to have something to look at. So today my shirt says I'm cramazing. Like I am crazy amazing. Why? Because I'm a doula. Why? Because I'm a woman. I love this stuff. Like I'm a nerd for it. And if I could give you anything, I want you to walk away with that message in your head. Like I'm amazing. Like what's crazy mean? I'm crazy amazing. And not me. I don't want you to think that, oh, Jenn's crazy. No, I want you to feel like, hey, I am crazy amazing. Why? Because I woke up this morning because I'm doggone awesome. Like what, like, do I need a reason to be crazy amazing? No, I don't.
No.
Like, I'm just freaking amazing. That's it, you know? So, look, we can stay here all night. Look, I've been trying to cut us off for like the last 20 minutes.
I know.
Like, I'm trying to be good about time.
So I'll just leave everybody with this because I can't stop studying it. I'm telling you, the way the negative thoughts affect your brain, it's just, I'm just constantly like reading about it. And so 2 things I wanted to leave you with. One was when you have like toxic negative thinking. So this was from Dr. Church's. It's called Genie in Your Genes. So literally when you have a toxic negative thinking, even if it's not true, even if it's not a reality, your brain will sprout a brain tree to basically as if that situation was real. So you have already triggered this stress response that's not really real. It's not reality because remember we said your brain can't tell the difference between the two, but it's still going to sprout a branch as if it is real. And also there's a doctor, she's like a neuroscientist, and she studies the effects of negative and positive thinking on the structures of your brain. And she said that if you saw what a negative thought does to your brain, you would never think a negative thought again in your life. And I remember I was like, whoa.
That's good.
But I love the fact that we can change the narrative. That's what I love. But it just threw me off because how many times do you say like, oh my God, I'm having a bad day. Or, oh my God, this was terrible. Or, oh my God, you know, even early today, it was just like, oh my God, it was, at least I've learned to structure my words. I didn't say it was a bad week. I said it has been a week.
Oh, yeah.
So.
And then I just want to add on to that, because if you think about that, when you're pregnant, and if you're having these bad thoughts and you're creating these branches and trees in your brain of negativity, what is it that you are doing to your baby, to this life that you're growing within you, and the negativity that you're placing on them, you know? And sometimes, you know, people I just had this conversation, like, are conceived sometimes in negativity, conceived in mess. Then you carry this through your pregnancy and there's still negativity. Then, hey, it's time for me to have a baby. And then you go through, everything we just talked about. It's still negativity. What are you bringing into? And then you have a baby in your life and boom, negative, 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 negative. Then what are you fostering in this child? So, as you're pregnant and as you're, going through birth, getting rid of all of that negativity, because it's not just affecting you, it's also affecting the life that you're trying to cultivate and bring into this world.
And it's real. It is
It
all
is.
real. This is not just blowing smoke in the air. This is all very, very real. And so,
man, so this is great.
Wrap it
This
up.
is great.
We won't start talking about epigenetics tonight.
No. We've already been on for way too long. Okay, so I'm gonna say one thing and then I'm gonna do my closing. So 1 in 7 women are affected by birth trauma. It's important to understand those numbers because, like, if you're like me, I have a whole bunch of girlfriends and all of us have kids. And so if you look at women like who've had more than one kid, somebody's going to experience more than one different type of birth trauma. Understanding that, being able to prepare your heart and your mind of how you're going to navigate either trauma or into a positive experience. My first answer is always education. My second is always proper support. And if you're looking for support in any stage of your pregnancy, either Eb, Nicole, or I, we are always available to our communities. I am a fertility coach. I am a birth doula, as well as a childbirth educator. This week, I had my childbirth education, the second edition to my childbirth education course launch. If you're interested, follow me on Instagram or Facebook. My website is www.inlovebirthing.com, and I would love to avail myself to you. Nicole, what you got as Ebony gets ready to close?
Well, like Jen said, we're all available, whether it is for preconception, it's pregnancy, it's birth, it's education. I cover the Charlotte area, but then I also am virtual in all of those areas. And I also do placenta encapsulation as well. And I just released my fertility doula packages. So now I'm on the front end of all of this. So anybody who's looking to conceive or has been already working to conceive, let me walk alongside of you in that journey as well as we lead into pregnancy and birth. So, and it's been a great night, y'all. It's a pleasure always. I love our conversation, so I can't even wait for the next one.
And I'm Nurse Eb. If you're just joining in, I am a nurse. I've been a nurse for 16 years, and I also made the decision to become a doula, fertility birth doula, lactation education specialist, and currently certifying as a placenta encapsulator. All of the things birth work. I just want to say that I literally understand what it feels like to not feel safe, to not feel seen, to not feel heard, to be in a room with people who are supposed to look out for you, to take care of you, and to literally feel so neglected, so looked over. And I just know what that feels like to be uninformed and to make decisions from an uninformed place. And I'm always so passionate about making sure that you guys have the education, the information, the tools, and the resources that you need to make an informed decision. No matter what that decision is, it should always be from an informed place because you deserve that as an individual. And so that's really what I'm so passionate about. And just wanted you guys to understand that you can reach me. My company is In Harmony Health, Birth, and Wellness, because of course I'm passionate about wellness as well. Fertility doula, I do work with you guys through the preconception period. We also, as a birth doula, in my opinion, it's never too early to contact the doula. If you're thinking about getting pregnant, you just got pregnant, talk with somebody, get the information that you need. And of course, if you need your placenta encapsulated, we can do that as well. In the postpartum period, I do provide postpartum services, and we can kind of look at that and see what you may need. But this has been phenomenal. I always love sitting with you ladies because although we all have the same passion, we equally bring something amazing to the profession of being a doula. And I love that. And it's great that we're continuing to putting it out there what a doula is and how important it is to have one, because we don't just come to the birth and help you get the baby out. It's so far beyond that. So
I love it. I love it. Cece, we see you. I see you looking. We see you. Thank you. Thank you for staying on with us. I know we've been on for well past the time.
My brother's been on listening.
Come on, come on. You said your mom?
My brother. Come on one time for the black men.
Come on, come on. Support right there. Yeah. All right, let's wrap it up. All right, ladies, thank you so much. Thank you so much. I'm definitely humbled being in the room with you guys. Thank you.
Thank you everyone for coming on, and we will see you guys on the 24th, correct? During Black Maternal Health Week.
I thought it was the 15th. We'll post about it. We'll post about it. Don't make us lie tonight.
No, today was the 24th.
It is. I was like looking at my calendar, like, wait a second. It is the 24th today.
Okay.
So
next time it's gonna be like we'll post about it.
Black Maternal Health Week, which is April 11th through the 17th.
Come on, right there. So it's the 15th. Yeah, it's the 15th.
Yes.
Live April 15th. All right.
Beautiful.
All right, y'all. Y'all have a good night.
Guys, have a great night.
Good
Thank
night.
you.
Thanks, y'all.
I love y'all. Thanks for hanging on. Thanks for being with us tonight, and we can't wait to come back again. You guys were phenomenal. I am going to start putting up the Q&A so you guys can ask your questions whenever you're ready. And you get a chance to kind of put your questions in the chat, and we can go through your questions to make sure that we don't forget anything. But you guys were phenomenal. I appreciate your engagement. I appreciate you taking your time to spend with us tonight. We don't take it lightly, and that's why we want to make sure that we give you information that you can actually apply to your life and that's actually going to work. So I love y'all. You're amazing. Take care of yourselves, and I leave you with peace and I leave you with ease.